Good afternoon, everyone. Good afternoon, New Mexico, and good afternoon, Dr. Grace. Since I can see you on my screen, and happy early holidays to everyone in New Mexico. You can see I'm in the living room of the residence, and we have started to do some holiday decorating and bringing in a little bit of holiday cheer. And I hope everyone is finding their way to safely navigate that. Christmas is going to be just like Thanksgiving in the context that we really have to think about how to safely distance ourselves from our families, to celebrate both in terms of our faith-based efforts and just what the holidays mean in terms of bringing families together. We are still in an extreme risk situation. That's true in New Mexico. It's true across the country. And everything we can do that lifts our spirits up and reminds us about why the holidays are so important to us and our families, while at the same time working hard to get ready to celebrate it big next Christmas or Christmas in July, and to really think about ways not to mix our households. That we really have to rededicate ourselves to that. Okay. Let's get started. First slide, and it's going to be our case update, everyone. Okay, so today we have 1,791 new cases. That brings the total to 114,731 total cases statewide. Again, we have 23 additional deaths. These are incredibly painful when we announce them directly every week. They're painful every time we put out a press release about the data. Given where we were and what we fear in the next coming months, this could climb much higher. We should all, and I do pray that that's not the case, but we are again in extreme risk. Our condolences to all these families who are grieving, and to all of the healthcare workers who are on the front lines, who are holding their hands, who are connecting to say goodbye with their families on FaceTime. This is incredibly traumatic and tragic. And again, New Mexico mourns with everyone, every family who's lost a loved one. Unfortunately, that brings us to 1,846 lives that we've lost to COVID-19 in New Mexico. For COVID hospitalizations, and this is just for folks who have COVID, we have 916 people in the hospital. This number is very frightening. I don't want people to be frightened, but I want you to see that this is a dramatic number, and it is why we have to work harder, even though we're going to report some good news. We have to do better at minimizing the transmission of COVID. We have 159 New Mexicans on ventilators. Again, the entire country is seeing this kind of a surge. It means that we're over hospital capacity nearly everywhere in the country, at least at one of their hospitals, if not all of their hospitals in the country. And that means that ventilator supplies can be, in some states, stretched. And what we were doing as a country is sharing supplies. And in this context, we can't do that. So if we had issues, I can't count on the ability to share those with other states. So we are serving every New Mexican who needs us. But we are getting to a place where it's really dire. And we've got to do better by minimizing the number of folks who contract COVID and minimizing the number of folks who need hospitalization, and of course, therefore, minimizing the number of people on ventilators. Next slide. Now, this is the good news, and I want to be cautious. And the reason that I'm cautious and cautiously optimistic is because we know that there's a lag in the data. We know that a 2-week effort, which was helpful, and this shows unequivocally it had the impacts we were desiring. when people see that it worked, there is too often human nature, an invitation to go more places, relax our mask wearing, relax our bringing our families together. And then you just go right back in the other direction. And we can see in mobility data that Dr. Grace will talk about also some good news. But we can also see that it's beginning to trend in the wrong direction in far too many communities. So this chart here is the epidemic curve, and it just shows you, right, how many cases, where the spikes are. And you can see at the end here, right at the end of November, that we were coming back down. And that is exactly what we were aiming for when we did our 2-week reset. So what happened? So the positivity rates, right? Those are when you test a group of individuals, the number of people who were positive outside the number of people who were tested, I'm generalizing, that becomes your positivity rate. Positivity rates climb. We know that it means that the prevalence of the virus is increasing in every community. That leads to doubling rates, exponential growth. That's all bad. Test positivity rates came down. And what does that mean? So if over a 7-day period, we decreased from a 24% positivity rate to a 13% positivity rate. That is exactly the kind of effort. Now we are aiming for about a statewide 5% positivity rate. So you can see we have a long way to go, but this is exactly what we were hoping and aiming for. This is something that I think can be hard for some of us, for example, myself, that this R effective rate. It's basically the measure that it's how we measure how the virus is spreading, how fast, rate of spread, if you will. And this measure is a very important measurement. It's in our gating criteria because we know for every positive case, we can tell you that how many more New Mexicans could be infected. And so you want that number to be below 1. And in fact, the further below 1 that it is, the better the situation is for controlling, managing, fighting the pandemic. Now, when we went to our reset, we were at 1.3, okay? So above 1, that's the wrong direction. From November 9th to December 6th, we've dropped to 0.79. And I want to point out that that's one of our lowest, if not the lowest, R effective rate we've had in the pandemic. That is a very good indicator. All of this is exactly what we were looking for in a reset. It allows us to bring those cases down. It allows us to reduce hospitalizations. It means means more lives are saved. The issue is that 2 weeks doesn't really change the entire trajectory. So this is not an invitation for people to go out more. It's a recognition that those solid public health practices work. And if we keep them up, we can give our healthcare workers a rest. We can make sure that we don't completely overwhelm our healthcare system, and we're there. It means that we can serve other New Mexicans who don't have COVID, who need hospital care. And it means that we have more opportunities in the economy, more opportunities in education. So we really have to keep doing this kind of effort. And I'm very encouraged by our red to green county by county efforts and what that is showing us. Early indications are that several counties can get into the yellow by next Wednesday, which means they can open up a little more, and that feels really good. And it is an indication, one more time, these efforts work. It's why we do them, and we want to keep trending in the right direction. Next slide. Okay, so I really already said all of this, which I'm sure to the folks who do this work to make sure that you can see it, you can take screenshots and share it. We appreciate that. We know the media does that too. I really appreciate it. Look, the New Mexico hospitals, they really need us to step it up. I frankly do not know how they do it every single day. But they do. They are clear about their mission. They're clear about their efforts, but they have far too many patients for the number of healthcare providers we have in the state. And remember, New Mexico has fewer than the average per capita for other states. So we just have more risk here. We have to do it better than any other state in the nation. And we have shown over and over again that we can do that. And I'm really encouraging us to stay the course. All right, this means that you really have to work hard on this unnecessary travel. Talk to your employer if you can telecommute. Work hard if you can to do curbside or delivery to your home. Avoid every kind of group and gathering. I mean, these are the places where we see that exponential spread and the most risk. Mask up, work hard to wear your mask. You know, I've got a mask out here. I'm here alone, but you know, it's just good practice. I wear my mask because I know that if I step outside or if I had to go somewhere, I have to have this mask on. I make sure that my fiance and I do our very best to protect each other. That means that we're doing mask wearing. Think about if you can increase and improve your mask wearing personally and in your family. New Mexico small businesses and our local economies, quite frankly, are depending on us. They cannot make it if we don't do all the public health measures. I mean, they are completely, unequivocally dependent on our good public health measures. Without them, we just bring this virus to them. Here's the best Christmas gift that we can give New Mexico's economy. All of those families who have family businesses, blood, sweat, and tears, their life savings in these businesses. We need more New Mexicans to get tested. Tested is one of the strategies that allows us to track this data, to isolate positive cases, to make sure that we know where there are outbreaks. This is a critical vehicle. And we are now, and you'll hear more about that, expanding testing options, opportunities, and efforts. But we're seeing a decline in New Mexicans who are getting tested. The more we know about it, the more we drive down these positivity rates. The more we drive down positivity rates, more counties go into yellow and green. Give that gift. You'll be saving a life and you'll be helping New Mexico businesses. Get tested. Please, we need more New Mexicans who are willing to get tested. It's critical for us to win in our fight and battle to manage and push COVID to the lowest prevalence rates possible. And I already said that. So visit togethernewmexico.org, togethernm.org. This will help you identify a testing site, but we really want to encourage you to get this done. This is the most critical aspect of getting this virus even more under control. Okay, next slide. So I'm just going to remind you, I think visuals work, and we're seeing many of our grocery stores do this visual. All right, try to think about, I won't go more than 3 places: work, self-care, errand. Self-care includes, right, childcare, early childhood education support, doctor's visits, mental health wellness visits, a walk, and errand includes the things that are really necessities, groceries, fuel, but try to get this done so that you never go to more than 3 places in a day. And if you can make this 1 a day, better. This should be the goal for no more, but for all the New Mexicans that can do better than this, do better than this, because this will really help us over what are going to be the most critical, tough next several months because of Thanksgiving. So we see the impact of that coming now. And then Christmas, we see the impact of that coming now. Americans have been traveling again. These are all of the aspects that we know bring great risk. And we've got to manage this virus better because we will overwhelm our healthcare system. And I mean completely overwhelm it, where there isn't an available space or practitioner to support us. and we will lose more New Mexicans, and we don't have to. We can do something about it. Okay, next slide. All right, so I want to do a quick update, and then we're going to go to Dr. Grace so we can answer questions. While I'm very worried, and all public health professionals have been sounding the alarm that because we're driven indoors without masks and families are mixing, and then we take it out to businesses, and then we've had the holidays, Labor Day, Halloween, Thanksgiving, and now Christmas coming up with people very mobile and traveling. We know that we're in for a rocky aspect for the country. We're really concerned about it. I'm concerned about it right here in New Mexico. But there is an incredibly bright spot, and that is that vaccines are frankly here. There are not going to be enough vaccines for any state, including New Mexico, to be able to provide vaccines to every New Mexican who needs them and every New Mexican who wants them right away. But it tells me that with the vaccine distributions, in the next 3 to 6 months, we are really going to see dramatic improvements in the risks associated with COVID-19 and the ability to begin to have sort of more normalcy in our everyday lives. Although I submit to you, I think mask wearing occurs for a year. I just want to make sure that we're giving people accurate, adequate information about what our lives look like so that we can plan and adjust and prepare for that. So here's what's happening. The Pfizer vaccine is the first vaccine that will have FDA approval, we believe. So they're finishing up all of those review processes, but we believe that that FDA approval in what they call an emergency use authorization, it doesn't mean that they've skipped the safety aspects. It means that getting it out, they changed the way in which that is readily available because we're in a pandemic. Once that approval is made, we will get the first shipment within 24 hours. So we've been preparing and are prepared. We believe that that first shipment could happen as early as next week, and we're expecting 17,550 doses. Those vaccines will go directly to hospitals and their practitioners who are seeing mostly COVID or COVID ICU, what we've identified as intensive care for COVID patients, will get those vaccines first. And we will look at also healthcare workers who are on the high risk category because of their own underlying conditions. So the Department of Health has notified New Mexico hospitals of those allotments. We've let them know how they identify which practitioners would be in line for those vaccines first, and they're going to be ready to go. These require extreme cold storage, and everyone is ready to do that. And we've got the abilities to deploy these vaccines where they need to go immediately. We're going to get additional vaccines. The second vaccine that we expect to get FDA approval is from Moderna. Now, those vaccines are slated for nursing home residents and staff, and it's going to be like that 17,000 allocation. It isn't going to be enough to do every CNA, certified nurse aide, every staff person at a nursing home, and every resident. So again, it's looking at those high-risk facilities with high-risk residents, high-risk staff, and we're going to be using, which the federal government already had a system in place to use Walgreens and CVS. They'll receive those allocations. They've got an approved effort from the Department of Health that will identify those facilities, and then that vaccine will be available. It will take several weeks of vaccines coming in before we have holistically protected healthcare workers and long-term care residents. Once that's done, and that will be well into, we anticipate, February, early March, then it's essential workers, childcare workers, corrections, police officers, first responders, individuals who are high risk. And we will be finalizing those plans that have to have federal approval. And we're really looking at what those timeframes look like to get those vaccines out, and feeling very confident that New Mexico will do a productive, safe job. Dr. Grace will talk about a little bit about this, but our MAT team, as promised, will double check that all of the federal required review processes have been met. We committed to that to New Mexicans. We see nothing so far in this effort that would indicate that we have any credibility challenges with FDA or these first two vaccines that are making their way across the country and into New Mexico. And I just wanted New Mexicans to know about this. And we'll talk more about the specific efforts in planning as we get more detailed information from the federal government. I believe this is my last slide. Is that correct? It is not. I'm sorry, everyone. I wanted to make sure that everyone knew that what pandemic relief, what it's looking like. And I want to remind everyone to please work to access these programs. They're meant for you. So we got $330 million out of the special session. We have $100 million available for small businesses. Applications close December 18th. So we're coming right on that deadline. You can go to nmfinance.com. 7,600 businesses so far have applied for grants totaling nearly, I believe, 80 million. So get in there. We expect grants to be out the door by early next week. So they're finishing up the review processes. You can see that the doors don't close for applications till the 18th. Get your application in, nmfinance.com. Unemployment. 194 million is going into supplemental unemployment payments. We are going to distribute $1,200 checks this month. And what that really means is I believe we're going to be ready to go next week, mid next week, and we're working to get it fast. No additional actions required for anyone who is on unemployment. If you are out of benefits, if that happened, you used up all your benefits through October, this $1,200 is still available to you. And for the numbers of individuals, because of the reset that have gone into unemployment, you're going to get unemployment plus the $1,200. It's coming. And we want you to apply if you haven't applied. Really important to get that into your family's hands. We know that there's real financial insecurity. Housing assistance, 15 million in aid for emergency housing support. Those applications opened on December 10th, and it's housingnm.org, housingnm.org. There's also more in food security, and Dr. Grace can talk a little bit more about that. That's being managed out of, and general assistance payments, that's being managed out of the Human Services Department. But we are clear, we need to lift everyone up to the highest degree that we can. And I wanted to make sure that New Mexicans know this is available to you. It belongs to you. And we want to get it into your family's hands as quickly as possible. Okay, now I think I'm out of slides. Yes, I am. So we're going to go to Dr. Grace, and then we're going to go to questions. Thank you, New Mexico, for tuning in. Dr. Grace.
Thank you very much, Governor. And let me just touch on a couple quick things so I don't forget them. On the vaccine, I agree. I think there was some concern in the summer that the vaccine was being rushed in a way that might not allow for complete scientific review. And it appears that all of the established processes that have been set up for previous vaccines are being used now. And so we're happy about that. And I'll talk about food and general assistance at the end. Hopefully you can see a slide that says testing 101, and this is not meant to be a insult to the great knowledge that our regular viewers have about this subject, because New Mexico leads in testing. We've had a great strategy all along, but there have been a very large number of changes that have happened just in the past month, and we thought it was really important to update all of you. And so first, just to remember, the reason we test is to identify people who are carrying the virus so they can be isolated, and we can find out who their contacts are and get them quarantined. And all of that is to lower the spread of the virus. You saw that our effective, that spread rate, you know, what that means when it goes less than 1 is that for every person who gets coronavirus, less than 1 person is getting it next, and which is what you want. If it's more than 1, the curve goes way up. When it gets to be less than 1, we start to see it come down. So, and all of that is based on an effective, not only an effective and broad testing strategy, but one that can be responsive to new science, new methodologies, and I'm going to talk about that today a little bit more. Just to remind you that we talk about cases. Those are people who are identified as having a positive test. Most of those confirmed by epidemiology, but and just a reminder that if you have 1 test that's positive, you're counted once. If you have 10 tests that are positive, you're counted once as a case. That always comes up. And then the contacts are those people who spent more than 3 minutes within 6 feet of somebody with or without a mask, where you have a much higher chance of getting this virus because it's so incredibly infective. Contact tracing is where we, as I just said, identify cases in their contacts and get you separate from other people so that you won't spread the disease to others, and we can get this down. And remember that isolation is that 10 days a sick person stays without contacting other people, or someone who's positive, because you don't always have to be sick. And then quarantine is for contacts. It's 14 days because that the person who's sick spent 3 to 4 days getting COVID and becoming infectious, so they get a discount. I will mention today that we're looking at the new CDC guidelines, evaluating those, and assessing against our own data the possibility of shorter quarantine. But all of this process has to work together. If everybody got tested every day, but we didn't do anything with the results, we wouldn't be able to completely control the virus. So it all has to work together. So updates on the testing strategy, if I could have the next slide. We just kind of put together our goal of testing in the state is to have accurate, accessible, timely testing for every New Mexican. That's what we want to do. And so when we say accurate, we want to use the best tests possible. This is where New Mexico has particularly excelled. Almost all of our testing has been done by laboratory PCR tests that checks for viral genetic material. It's the most accurate. It's more accurate than antigen testing, and there are new lab antigen tests. Both of the laboratory-based tests are much more accurate than the rapid tests, but we're finding ways to use those as well. Rapid tests, much more useful in people with symptoms, much less useful and less accurate in people without. And then I just wanted to caution everybody, I predict that over the next couple months, the market will be flooded with home COVID test strips that you can use. They're just little pieces of paper that maybe you'll spit on or something. We will be evaluating everything that comes out. We'll put out recommendations, but the early word on many of these simple paper test strips is they're not going to be highly accurate. So more news on that. And then lastly, antibody testing is now becoming widely available. That's a blood test where they look to see if your body has had an immune response to coronavirus. That helps us to know if you have developed antibodies. We still don't know exactly what that means about preventing future infection, but it doesn't diagnose you while you have COVID. It only turns positive at the very end. So that ability to isolate is lost. Now, also, if you've had a test, you know, it can be hard sometimes to get it scheduled and get there and wait in line and do all those things. And I think we don't have to remember back that far to when people were showing up at 2 in the morning at Bloom Fiesta Park to get Presbyterian to swab their nose and run a test when they opened at 8 o'clock in the morning. And so the most simple way of doing this that will be coming out soon is where you can just do the test all by yourself at home. We haven't had the chance to evaluate those, but I think those are coming. We are now using tests where you can do the test in your own home. There's a number code, you put it in the system, they mail you a test tube quickly. You do a variety of different ways of giving them a specimen, mailing it back. Obviously, wouldn't that be great if we could all get a test without leaving our own home? And then there's drive-through, which I just described earlier, and probably a third of New Mexicans have experienced that. And then lastly, and more rare, is going into a facility like an ER or something like that and being tested there. But of course, that's happening. Used to just do nasopharyngeal swabs, deep swabs. And I'm going to show you some slides that just show you pictures of what these look like. But, you know, the easiest thing is saliva. You can cough 5 times like that, clear your throat, or cough, and then collect saliva in a tube. That's highly accurate and more accessible. You can swab your own mouth now with or without supervision. And then you can, you know, do a nasal swab yourself now. And then there's the traditional method. But, and then if we have more suppliers, which we do, that gives you more options to get tests collected as well. I'm going to talk about that next. And then timely, you know, we have struggled. I mean, this is a challenge to, you know, from the time, we really think that the key time is from when you need the test to when you get the result. We don't want that to be a week or 10 days, you know, like it's been in the past. We want to get that down to a really short time frame here, 2 days. And so the main strategy we're using for that is, in addition to the incredible gratitude we have for our state lab and TriCor and pathology consultants of New Mexico, who've actually substantially ramped up their testing capacity, because we need to double that testing ability. We're also working now with new out-of-state partners. So Curative Medical Services, or Curative Labs, has 10 new sites where they co-locate with DOH in southeastern New Mexico. There are 3 in the greater Albuquerque area, 1 at the Balloon Fiesta Park, 1 down in Los Lunas, and 1 in Rio Rancho. There's 1 up and running now in San Juan County, Luna County, Rio Arriba County. 2 sites opening, 1 tomorrow in Las Cruces, another on early next week in Sunland Park. And then Vault Medical Services, which uses a mail-in strategy that I described earlier. We're now up and running with them as well. And they're currently testing childcare professionals, folks on DD waiver, and a lot of testing in schools. So we're finding that this rapid expansion and making it easier and more accessible, we're hoping is going to encourage every New Mexican to say, you know, I'm feeling nervous, I'm not feeling good about that contact, or I've got a relative who's sick, or I have any of a number of symptoms, I want to get tested. And that's something you can do and have a result back much more quickly than ever before. And then lastly, and I want to ask the governor to comment on this whole strategy, because she's really been behind it and driving it from the beginning. And I think given us a lot of successes. There was a press release yesterday from Secretary James Kinney. We've been monitoring and looking at this idea of testing wastewater since the summer, when early reports came out. And we now have the ability in certain appropriate settings, like for example, in a correctional facility where staff and you know, the residents there generally stay put. Of course, staff come and go. Or in other sorts of situations, could be a college dormitory where some testing has been done. And the Environment Department is getting involved in spearheading this effort to actually test wastewater. Now, just so everyone's clear, it tells you whether there are 0 cases or more than 0 cases. And right now you might think, you know, we got like 1,700 cases a day. How could this help? Well, we're going to work out the bugs. We're going to get it up and running. But when we get to the point where case counts are down, it will allow us to test 400, 500 people at a time through wastewater sampling. And then if it is positive, go in and do more extensive testing. So I'm pretty excited that we've been able to adapt to and bring on all these new techniques. They're getting up and running. Some of them we're still working out bugs, but DOH and Teresa Casados and Courtney Herster and other folks in the governor's staff have really been helpful in moving this along. And Governor, I know this is a passion of yours, and I just wanted to see if you wanted to add any comments in here before I go on to the remainder of my slides. and you're on mute.
Muted myself, Dr. Grace, so this was clear. Yeah, Dr. Grace and I, the entire MAT team in the Department of Health, we want you to see that we've been building a testing strategy. New Mexico was the first state in the nation to have a drive-through site up. We've tried to be very aggressive in making sure that testing is easy, reliable, and we have incredible lab partners. Our own state lab, Tricor, and others are amazing. But when you have these big surges, and when we have nearly 4,000 cases in a day, our lab partners get behind. And that then has a snowball or cascading impact on our ability to do everything that we're talking about. Plus, the more cases you have, as we've talked about, than just the math, more testing has to be done so that we know about positivity prevalence. We have to know that in order to deal with those outbreaks and to get people isolated and quarantined. So it means that we have to bring more testing. The way in which we do testing is labor intensive, and PCR tests, which are the gold standard, take laboratory, they must be run at a qualified lab. So what we're trying to do is bring in all of the other available aspects, be very clear that we're not going to minimize New Mexico's gold standard, but we are going to embrace and engage in every single testing apparatus and strategy so that we can get to what I would describe is a more universal approach. It's readily available, it's fast, it's reliable, because even with the vaccines, we're going to have to do testing for a year or more in the same way that we do flu testing. But this is a deadly virus. It's going to take us a year to have the kind of vaccine penetration that you must have in order to really have no prevalence of the virus and very little risk. So testing is the key. It's the absolute key. So we want to make it easy, and we want to keep building this system out in the state. And I'm very pleased with this effort. The wastewater is the way in which we're going to be able to see it before it happens, really, so that you can minimize an outbreak. And that's critical in corrections, colleges, small towns. There's a number of places where this is going to be instrumental, essential workplaces. In some states, you're looking at hospital wastewater systems. So this is a way for us to always know what's going on, and it's surveillance. And we also do some pooling still. And we didn't want to make it too complicated, but want New Mexicans to see and hear. We know that for a while it was hard to get testing. Everybody came at once. Now we're seeing that New Mexicans aren't engaging in testing. We also have private sector partners, big box stores, who are doing their own testing, sending it to their own labs. So we know, one last time, effective testing strategies is part of that public health effort. Masks, distancing, hand sanitation, washing your hands frequently, and staying away from people. These are the things that will put New Mexico on the right track all the way through the other side of this pandemic. And I can see the other side. That's why this is so critical and so important to an effective overall strategy. Thank you, Dr. Grace.
Thanks, Governor. Just one technical correction of what I said. Folks in DOH on waiver programs will all be migrated to the Vault Medical Services mail-in strategy by January 1st. So with that, I think I'm going to go on. I just wanted to show you a few pictures about these. This one is how to collect your anterior nasal swab samples. So easier to just in the nose, not all the way back, as some people joke, into the brain. It's not a brain biopsy, but just a simple swab of the nose that you can do at home. Next one is saliva, just exactly what you would think, just some simple production of saliva after a couple coughs into a tube, wrap it up tight, mail it in. And just to mention, lastly, you can also get saliva through a mouth swab, which is the next slide. There is a little video of this guy doing this in his car, and it's 90 seconds long, and I'm not going to show it, but It's just another simple way to get a specimen. So it's getting easier, it's getting more convenient, but we want to stick with that most accurate testing we can, the PCR, which we're doing with all these new vendors. Okay, next slide. I wanted to just add 1 day's worth of data point to the epidemiologic curve that the governor showed earlier. And you can see here on the top blue dotted line, the curve goes up. I think the reset really did work. I mean, we were able to flatten that curve. The slope started to come down, and now it got flat, and now it's taking a dive. Now, we don't know. We know that the reset helped a great deal, and we know that Thanksgiving holiday helped somewhat because people were less mobile. I'll show you that in a minute. But we are seeing a tick back up, and that's very worrisome because of the state our hospitals are in, and they just cannot take on another 100 patients at this point of time. You can see that little uptick occurred in all 5 regions of the state as well. So we're watching that very closely every day. We talk about this and go over it every morning. We'll do it again tomorrow, but that's something everybody who's watching here who's interested should keep an eye on as well. Next slide, please. I mentioned mobility. We did have that dip. You go, again, if you're new, there's a horizontal blue line that the average New Mexican who drove less than 50 miles a day was driving about 6 3/4 miles a day before the pandemic started. We dropped down to actually below 4 a little bit, then came back up and we're running 5.5 miles a day, and then back down again with the reset. So positive effect on mobility, but discomfort and worry, at least in me, at 2:30 in the morning about the fact that these curves are ticking back up. And so again, watching that closely and an additional plea, just really evaluate whether that trip out is absolutely necessary or not. Next slide. So there's been some national press. We showed you a week ago where New Mexico ranked 3rd. The good news is we're now down to 24th. Again, I think that's a result of the reset. We still have 3 New Mexico cities in the top 20 in the country. I'm not like picking on our 3 New Mexico cities. I mean, those folks need our support. They need our help. I know of active efforts in a number of those places to increase testing, to try to identify more people and isolate cases. And so, but that, our overall national ranking has improved over the last 10 days or so. Alex, next slide, please. This is the cases by age group. Unfortunately, the gray is where we're not really supposed to look because we don't have a complete data yet, but we will see a downturn in all the age groups. I can tell you that. We'll have a new final version of this soon. And so we are seeing a downturn. We worry most not about the top group, which is the 18 to 34-year-old age group, although we do have hospitalizations and deaths in that group. We definitely do, but just not as many as the next 2 most common groups, the 35 to 64 and the 65 and over. And that's where our hospitals are struggling right now with that increased volume. Next slide. This is a slide from Lannel. I simplified it a little bit so I could understand it and explain it to you. But one thing I haven't talked about is the fact that when we think of this, you know, we think of the curves going up and going down, and we show you the regions very much in parallel, kind of going up and going down. But in what's really happening, and just focus on the box on the right here, is right now, the good news is 1.3 million New Mexicans live in a county where that spread rate is declining. That's good. 206,000 additional New Mexicans live in a county where the growth rate is constant. It's neither going up or going down. And the worry, though, is that 570,000 New Mexicans are in counties where the growth rate is still going up. And so we don't always see that detail. And I think the new county metrics are going to help us see that better and know as a state, and for folks in those communities and leaders in those communities, where to focus efforts as well. And this has been a phenomenon that's occurred throughout the pandemic, but as we get much more specific and focused in specific areas, I think understanding this and understanding the need for extra effort with testing and masking and contact tracing in these accelerating counties is going to help us be more specific and successful, I believe. Next slide. Again, the top curve I just talked about and just showed you that new data point was a rolling 7-day average of 1,610 cases on the 4th. Remember, we have a 6-day lag for this measure, so older tests that come in can be filed in the appropriate date. I did want to focus a little bit on hospitalizations at 932. That's just hospitalizations for coronavirus patients. We have hospitals now that are over 50% coronavirus patients for the first time in the pandemic. We have intensive care units that are 100% coronavirus patients for the first time in the pandemic. We have hospital ICUs that have every single person on ventilators for the first time in the pandemic. And that it's very unusual. ICUs provide a broad spectrum of care for very, very sick people. But I know in my career, and I haven't worked in an ICU for a while, so I just want to be clear on that, never been in a situation or heard of a situation where every single person in an ICU was on a ventilator. And as a result, there's been a lot of driving of ventilators around the state and moving ventilators, high flow oxygen equipment from one city to another. And the other thing I wanted to say here too, and a real shout out to everybody working in hospitals, because they're really working hard and trying to adapt, and they're working together as one system. You know, for example, at 7 o'clock this morning, one of the hospitals in the South said they had 10 ventilators in reserve supply, and 2 hours later called, because they're a hub hospital for their region, and said that they needed 5 more. That was in a 2-hour period. And so this is a very dynamic situation, requires very tight coordination. And also our transfer center reports today that you know they started the day with 12 open ICU beds, and at the but when they called, hospitals aren't always able to take patients right at that time because of lack of staffing. We started the day today with 61 people in the emergency room who needed to be admitted to a regular hospital bed or an ICU bed, but there wasn't one available. And so those don't show up always in the total, they don't show up in the total hospitalization numbers. So anyway, I don't want to go on and on, but there is one last point I'll touch on when I get to the gating criteria. So next slide, please. This gives you a snapshot of yesterday morning when we called every hospital, how many beds were available, and lots of zeros around the state. And I'm not going to go into great detail. 73 total med surge beds yesterday, 33 ICU beds. By my quick math, that's a total of 106. This morning it was 65. So very dynamic, changing, you know, 38 new beds, I believe, filled just overnight. Next slide. We're almost done here. Yeah, the provider community asked me to bring this to everyone's attention. This is something as a geriatrician we do all the time, and in healthcare in general, ask people to be thoughtful in making decisions about what each of us wants. If we're approaching the end of our life, do we want to be on a ventilator? Do we want to be fed artificially with food and water? Do we want CPR, you know, resuscitation effort? And I would really encourage everybody viewing this today, you can go online, you can get one of these forms. If you do not have one already filled out, please fill it out. It's a good idea to do anyway. I've been telling people to do this for 30, 40 years, but this is a good time because you don't want to put your family in a position where it's a dire emergency and you haven't had that conversation. We know they're uncomfortable, but another gift we each can give to the people in our families to be clear about what we want at the end of life. You can see the website here. We don't usually put these on because they're complicated. This one is just www.nmmost, which stands for Medical Orders for Scope of Treatment.org. You can print the form, read it through. It comes with instructions. But I was asked to get that out to all of you today, and so I thought it was a good idea. And then finally, gating criteria, Governor already highlighted the improvement in spread rate. Of course, the case count is approximately 10 times what we need it to be to go out safely. The test positivity rate high, red, but coming down. And that's a very, very good sign. We usually see that as things start to get better. Contact tracing, I don't want to spend a lot of time on today. The ICU beds, I saw a comment, I don't spend a lot of time on social media that, hey, we don't need to worry. There's only 342 people in ICUs and we have 439 beds. But when we did that, and we put some notes on the website, that was assuming that was the number of beds we could create, that we would have staff for all of them. And I was told this morning that we only have, that there's an 85 bed difference. So there are 85 of those beds we can't staff, so we're still just 12 away. And next slide. We've received a lot of requests from counties that the math is complicated. I think that's right. This is available online, and it says, well, how many cases would a county have to have be below each 14-day period to meet that criteria for 8 cases per 100,000? And so this is a table. It shows this. I've had a lot of people call up and tell me, well, wait a minute, if Hardin County gets 1 case, that means they're red, and it's true. It also means, though, that it's pretty easy to get back to green. And the other thing to point out is that all these numbers for every county are equally difficult to obtain. They're exactly the same. So keeping below 1 case in Harding is actually just as hard as it is for the people in Bernalillo County to keep below 762 and vice versa. So let's keep that in mind, that this isn't about one county versus another. The bar is really the same, and it's all based on population. So that's out on the web, and you can access that if you need to. Next slide, please, Alex. I have to remember not to press my own buttons. The other thing I've heard a lot of is we will never get back to green. Never. It's just, this is impossible. These targets are too hard. Well, we did set the targets in the summer. These aren't new. We sort of finalized these late July, early August for the Economic Recovery Council. And so they're not new. This is where we were on the left 3 months ago. This is where we were last week. And I actually believe we can get back there. We're seeing some great progress with the reset. I'm hoping we'll continue that hard work to make that happen. And then finally, oh yeah, and final slide. Virus is the same. The reset did work. We have flattened the curve, but we have to keep doing everything we're doing, just like the governor said. I won't spend too much time because we want to have lots of time for questions, but the Swiss cheese respiratory virus pandemic defenses, you can tell it's British slide because of the spelling of defense, but it just points out that, you know, like protecting yourself from a virus is kind of like the holes in Swiss cheese. There's lots of different slices you can put on, but once you get enough slices, there isn't a hole that you can look through that the virus can sort of go through. And so things like physical distancing and masking and hand hygiene and not touching your face and, you know, all of these different things that you can do on an individual level, and then things like ventilation that happen on a broader level all help. So I know I covered a lot today, and I apologize. There's an awful lot of information, and I'm going to turn it back to the governor for some closing remarks and questions. Thank you. You're mute.
New Mexico, I apologize. I've been muting and more often because our internet coverage. I know that that's a frustration for so many of us in the state, but it keeps interrupting my feed. So I try to do is minimize the impact to even with muting. In any event, thank you for tuning in. Thank you for your hard work. You saw that we have improvements. We still have a ways to go. We can and will get there if we do it all together. So thank you very much. And Nora, we are ready for questions.
Thank you, Governor. We will start with Julia Goldberg from the Santa Fe Reporter. Julia, go right ahead.
Thank you so much, Nora, and thank you, Governor and Dr. Space. I have 2 questions, two and a half questions. My first question is, The December 7th hospitalization update in the health department's epidemiology report lists the percentage of hospitalized patients in that week who died at 18.8%. That's a full percentage point increase from the week prior. And if you look back to November 9th, when it was 16.9%, it's almost 2% higher. I was wondering if this increasing percentage of hospitalized people dying is related to the increased hospital capacity and the strain on resources, or if not, what you are attributing it to. And then my second question is related to vaccine distribution. Earlier this week, State Representative Derek Lente from Sandia Pueblo sent your office, Governor, a letter advocating for elders and others populations that have been disproportionately impacted by COVID-19 and expressed concern about vaccine distribution reaching people who reside in rural parts of the state. I wanted to know if you had a response to those concerns, but I guess more broadly, I wanted to ask, it sounds like the state is planning to follow the CDC guidelines about vaccine distribution in terms of sort of the groups you mentioned that are kind of economic groups, essential workers, childcare workers, et cetera, rather than some of the New Mexico specific demographics that have been identified throughout the pandemic, geographically more impacted and otherwise. So those are my 2.5 questions. Thank you so much for the opportunity to ask them.
So I'm going to let Dr. Scrace talk about the mortality rates at hospitals. I do want to point out that, you know, when we talk about, and this is an important discussion, when folks say, gosh, New Mexico is a really strict state, and does it work? Well, we've shown you and we've demonstrated it over again, it does work. And why are we so strict? Well, our population is so much sicker than the average populations in most states that they're at much higher risk for hospitalization, and unfortunately, death. And so there was a stat that I saw that's now an older stat. So I want to be very careful. I want to alert in full transparency the press that you'd have to check the stat today. But there was a stat that I saw probably a month ago that looked at the mortality rates in Colorado for some of their hospitals as low as 5%. And we were at that 16%, 17% range. If you just look at person to person, and you look at our at-risk populations in general, we have much higher risks. That's why we have worked so hard and have had many successes. Not enough until we don't lose a single New Mexican. So we've done the right work to save as many lives as possible, but this is exactly what keeps me, Dr. Scrace, to steal your phrase, this keeps me up at night every single night. So yeah, them do that. I did receive a letter from Representative Derek Lente from Sandia Pueblo, and I really appreciate that because there's no question that elders in general, minority elders in particular, and to refine that more, elders in multi-generational households in sovereign nations that are far too often without adequate access to healthcare and related public health supports and services are a huge issue. And it is something that we are particularly focused on and concerned about. So one, in the hospital and nursing home distribution, those are geographic as well. So every community, including tribal communities, and remember, there are tribal hospitals, there are tribal long-term care facilities, there are tribal assisted living facilities like at Isleta, and those are all in that mix. In addition, the federal government has allocated from New Mexico's per capita allocation, that's basically how they get to the numbers, sovereign nations choose whether they want to be included in the state distribution or whether they want to be in an Indian Health Service distribution. And 3 New Mexico pueblos have determined that they'll be in our distribution phase, and most of the other sovereign nations. So they're going to be able to determine when, based on their allocations, who their priority populations are. They will, in the first groupings, IHS will do their healthcare workers and follow that CDC application, interestingly enough. And the tribes that go through the state, we're allocating a much higher percentage of vaccine than they would get through a per capita distribution at IHS. So back to the point, how quickly can Representative Lente and others see that we're getting to those high-risk populations? As soon as we get the healthcare workers, because I can't save the lives of their elders or anyone else from diabetes or from renal failure or from COVID, if I don't have anybody in the hospitals providing that service. And the same thing, I've got all those elders in long-term care facilities that deserve our support and attention. And another fact for New Mexicans, the majority of healthcare workers at that certified nurse aide level in New Mexico are Hispanic or Native American. They are the minority populations. They're going to get protected first, and they are living and caretakers for the very elders that he rightfully is identifying as a high-risk group. So I feel good about our distribution plan. One more thing, and I know we need to get to the other part of your question. Look, it is really hard with such limited vaccine coming in at the front end. I wish that wasn't the case. I share, I think, in the negative reaction by a lot of policymakers and elected leaders that telling Pfizer that the United States didn't want access to 200 million doses didn't make any sense. We're gonna all figure it out together. And you might have seen, everyone, that they just announced that the advisory committee for the FDA has agreed to go on to that UA, the emergency authorization review, which could happen at FDA as early as Saturday. So we're on track, it looks like, to have those first vaccines shipped out early next week, as we indicated, but that's hot off the presses. But it's a very important question, and I thank Derek Lente now publicly for his advocacy on behalf of a population that deserves our support and attention, which is why we're such a strict state. I agree with him.
And Julia, as always, appreciate the math questions. Epidemiology division has gotten a lot more reports on their site there, if you've noticed. And so it's a little bit of a treasure hunt, but if you combine the data in the hospitalization report, which you cited with the 18.8% mortality rate, with data in the demographic report with about cases by age, and then data in the mortality report, I think, I don't have the exact answer for you, but I have a pretty good theory. In the month of November, 450 people over the age of 65 passed from coronavirus. The second highest month, 450 in November, was 180 in May. So basically tripled the number of deaths in that older age group. We know that older individuals have a much higher mortality rate. So as that case count went up with that group, that would be what I would predict. And many of those people end up obviously in the hospital as well. So I think it may be the influence of the resurgence of the disease in middle age and people over 65 that's driving that. But I'll drill down. We'll talk tomorrow with Epi, and I'll let you know if I have any other insights. Thank you.
Next question, Nora.
Thank you, Dr. Grace. And Governor, next we'll go to Dan Boyd with the Albuquerque Journal. Dan, go right ahead.
Yeah, good afternoon. Thanks, Nora, and good afternoon, Governor and Dr. Grace. Governor, I wanted to ask you, now that it appears the cabinet speculation regarding President-elect Biden's cabinet is kind of over for now and you'll be staying in New Mexico, if you could address that. And also if you could address at all some of the reports about you turning down a different cabinet position than Health and Human Services. And secondly, wanted to see what kind of some of the vaccine developments and kind of the current trends mean for schools. There's been a lot of concerns raised by lawmakers and other folks about when children might be allowed back into classroom settings. Thank you.
Sure, Dan. I'll have Dr. Grace talk about schools again. In addition to saving lives, protecting the healthcare system, We don't want furthering of economic insecurity issues for individuals, families, and the state as a whole. But your other North Star, saving lives, it's got to be to get kids back into schools. We have an older, as you know, population of educators. We lost an educator out of the Las Cruces area to COVID. These are all issues that we are combating together. We want to get our kiddos back in schools. And it's a plug for me before we go to Dr. Grace, testing, because then I can do that surveillance. We know our COVID safe practices are going to be good. We know that kids are not immune from spreading it or contracting it, but they're not a big high risk group. I think there's been new evidence that they're not super spreaders per se, but we know that we have risk. We've seen that in the number of cases, although relatively low as a percentage of population in in-person learning and with the community at large for folks who identify as education as an employer. So that's our goal. And that's part of why we're going red to green. If we've got the kind of collective support and collective will of all the policymakers in the same way, incentives and enforcement and support, then we get to a place where we get everyone back to school. And with the more testing opportunities we have, and if I keep hoping that some of these new, antigen, the rapid testing, that the accuracy improves, so it's not just symptomatic, but applications to asymptomatic populations. I have great hope, and vaccines. All of that is good news for schools. And I want to be careful for viewers. That is not a decision by CDC, the federal government, or the state that vaccines are mandatory for kids. Right? There's not even a vaccine available for kids. There's a whole lot of stuff. But if we lower the prevalence, we have more, so-called herd immunity by getting more people, adults, vaccines, then this takes away those risks by and large. By and large, kids can still get it. Kids can get very sick. The country has lost kiddos to COVID, and some of them without underlying conditions, but it really dramatically reduces that. So go to you. Listen, when I was invited to be a co-chair, it was clear, and I thank the president-elect for his confidence and his transition members in my support and ability to help design a cabinet. And he's in an interesting position, this new administration. I submit and have publicly many times that when you've got a federal government that doesn't care about federal government services, when you've got a White House that is working hard to really make it difficult for an adequate transition, you want folks who have been in those roles before. And then you want to make sure that you've got a reflection that looks like America. And then you want to figure out how you can leverage any number of bodies of experts in your cabinet. That becomes a very complicated process. So instead of worrying or confirming any of these rumors, Dan, I'm staying. I wanted to stay from the very beginning. I said that early, that it's an honor. I'm flattered. When the president-elect asks you to do stuff, it's hard to redirect the commander-in-chief or their team. But I can do more supporting this administration in any number of ways. They're clear about that. I have real clarity about that. And while it's a little bit of a roller coaster ride to get to that place, this decision certainly right for me. It's right for the country. And New Mexicans should expect a close working relationship with the president-elect and the vice president-elect. You should expect that we'll weigh in from everything from public lands to renewable energy and infrastructure. And you should also expect that they will look to New Mexico for our successes in healthcare reform, healthcare access, COVID protection, and I feel good about that. So New Mexicans should expect that I run for re-election in 22, and I will keep my fingers crossed that I will be able to convince all these hardworking New Mexico families that I deserve another 4 years. Thanks, Dan. To you, Dr. Grace.
So I may get in trouble here for going outside my lane, but I just want to make a comment about this as well. I've known the governor for over 20 years. We've worked together in a variety of capacities. I've known her as a cabinet secretary in New Mexico, and I have the great privilege of working with her as a governor. And I got to tell you, as somebody who's had a whole executive career and spent a lot of time matching leaders to their best possible positions, that I really think the governor is amazingly well suited to govern the state. And I don't want to make it sound like I have insomnia. I do wake up at 2:30 in the morning, but then I usually fall right back asleep. But I was worried. I was worried that we would lose her. So I'm delighted you're staying. Haven't had a chance to tell her that. And then on the schools, you know, we're on that one right now, Dan. I'm really glad you brought it up. Our morning 7 a.m. meeting, I took the assignment to pull together folks from PED, epidemiology, and the MAT. There's been a lot of new medical literature that's come out since August when we sort of outlined the framework for this. And our goal is to review that literature, to talk about some pros and cons, and to present a recommendation to the governor about this either next week or the week after, and we'll relay that to you when that decision is made. The one thing I will say is, one thing we do know is that the hybrid model seems to significantly reduce transmission. So that's something that, rather than changing that whole model, maybe building on is something we're going to consider anyway. And then the other thing too is just remember that the state is just one part of a really big equation about schools reopening. The districts themselves, parents, the kids, and right now Secretary Stewart tells me here between Thanksgiving and Christmas, only 10% of districts are actually doing any kind of in-person hybrid model school, and it only represents 5% of kids. So we will do the work and the science on our end, make some recommendations. But I think, I do think that as, you know, more and more of us get vaccinated, I think families, parents, districts are gonna start feeling more comfortable. And I will comment on that too, that in the vaccine models and distribution models that we're doing, every time you vaccinate 10% of the population, it has a much bigger effect than I was expecting on case counts and the like. So I think there's, even though it's going to take a little bit longer than we all had hoped, I think the impact could be greater. And so those are just some of the things we're considering as we go back and look at the school question in the next couple of weeks. Thank you.
Thank you, Governor and Dr. Grace. Next, we'll go to Joy Wang with KOB. Joy, go right.
Oh, sorry. Hi, Governor. Thanks for answering the question. I just had a quick question about mass gatherings and whether the state has looked into funerals and the likes, an event like that, whether there will be changes when it comes to mass gatherings. Thank you.
Yeah, so thank you for the question, Joy. This is really hard on families, and with the number of folks that we've lost, they can't have you know, their traditional family or faith-based services in the way that they're often accustomed to. So we have, it's still 5, and that greatly minimizes. So what many New Mexicans are doing, and it's still really hard, is they get through the basic and then they delay the mass or the funeral or the interment proper, where you have a gathering to do that until later. We will increase that in that yellow to green. That would be something that's available in that, you know, essential business category that's based on the and lifting it to 10 and then to 25 in that red to green. So that would impact how many people could say goodbye to a loved one and support each other in that grieving process. But today, with most of the states still in red, we're holding at that 5. And particularly, you know, funerals, and it's completely unfair. I want to be really clear about that. A pandemic knows no fairness boundaries. It just moves, it just wants us to get close and let our guard down. That's the perfect environment for a virus. Funerals are particularly hard. It's particularly hard to have a mask on. It's particularly hard not to hug a grieving family member. It's particularly hard not to pat someone on the back. It's just particularly hard. It's particularly hard to not have singing. I mean, all the things that we know and make us feel a little better about a loss. And so these are really high risk environments. So today you're in the red, it's 5. You get to the yellow, I think you can go to 10. I think in the green, you go to 25. And those gatherings are largely not to get a whole lot bigger until we've got more vaccine distribution. So I would look for a large gathering in the early spring is when I would anticipate that, 50, 100, that you start to see more of that, March, April. But it also depends on how the vaccines go and how our management of COVID goes. But just to give people kind of what I see around the corner, that's what I see. And you know what the goal is to, I know we lose people every day to natural causes, to old age, to cancer and other chronic diseases, to diabetes, to accidents. But we can minimize COVID deaths. We can minimize that folks are strained and further emotionally impacted by not being able to say goodbye in a way that they desire to. And one last thing about COVID, what makes the funerals and what makes COVID so cruel is that it is important. Every one of us has lost a family member or someone close to us. We all know how important that grieving, that cathartic ability to have someone hold us up, right? Shoulder to shoulder. There are far too many people who lost family members to COVID who couldn't say goodbye, who couldn't hold their loved one, who couldn't be in the room. And so the only way to sort of deal with that is to have a funeral, and you can't do that because that's high risk. And so I just want New Mexicans to, in this holiday season, to keep all those families in your prayers and in your thoughts, because it has really been painful for them. And they are in fact grieving in ways that none of us will ever really be able to contemplate, because they didn't get to say goodbye on the front end right, and they don't get to say goodbye on the back end right. And that hurts me to my core. And I just, we're gonna get through COVID, New Mexico, we are.
Thank you, Governor. Next, we'll go to Algernon Damaso at the Las Cruces Sun News. Algernon, go right ahead.
Thank you, Governor and Secretary Grace. We talked a little bit about the vaccine distribution strategy looking forward and the different categories of people and that line that needs to take place. Today, the DOH is reporting 26 new cases among prisoners, detainees, inmates at detention facilities and correctional facilities, 6 different sites across the state. And these are individuals who have very little control over their environment. It's hard to isolate themselves and hard to control the environment to keep themselves safe. As we plan the distribution of vaccines, is there a stage at which we'll make sure to be vaccinating these individuals in these populations? Thanks.
Yes, your point is incredibly valid. And I think too often the general public doesn't think about that, and that we have a responsibility to their well-being and safeguarding. That is the right thing to do, and it's a constitutional provision. We must do it. So they are essential, the workers and that population we identify as high risk. That's what makes this work really challenging. And so it's got to be twofold. The vaccines are a huge, bright spot in our fight against the pandemic. I am concerned that Americans will see this, Americans who want the vaccine. We've got 2 populations, Americans who want access today, and I don't disagree with them, and Americans who don't want a vaccine at all. Those are going to cross paths at the end of that distribution cycle, where we want more New Mexicans vaccinated, and we'll work on positive public health, science-based communications to build confidence in vaccines. But in the meantime, here's how we protect corrections. They have to be part of our high priority, high risk group population planning. They must, and they are. And if we lower the prevalence of COVID in our communities, red to green, they are similarly, adequately, and improvements in their protection. The same with nursing homes. Now you're right, they get the vaccine first, but it takes several shipments, we call them tranches, tranche 1, tranche 2, tranche 3 of vaccines before they all get vaccinated. So, and that doesn't deal with all the at-home caregivers. You know, we've got lots of older folks and folks with disabilities who have privately paid or family caregivers, and they're in that high-risk group. So if we lower the prevalence, they get adequate and improved protections, and they're included in our priority distribution. And as we get through these two populations, Algernon expect us to provide public access. It's not that we're hiding it. That didn't come out right at all. We are still developing that plan because it's contingent on how many vaccine doses we know we're going to get and how many vaccines actually get FDA approval. But those will be available soon. So you and every other New Mexican can see what our plan looks like. And again, it has to be approved by the federal government. And I expect that they get tweaked by the new administration as well.
Thank you, Governor. Next, we'll go to Morgan Lee with the AP. Morgan, go right ahead.
All right, thanks for this opportunity. I just wanted to circle back on some of the questions that have been asked already. If the Moderna vaccine is cleared, were you saying that the first round of that vaccine goes to congregate facilities specifically? And I also didn't understand, are teachers, they're not in line for a specific priority on the vaccine, but that's under consideration and will be addressed shortly. And then I guess the last thing is, are you going to publish, exactly who's getting this as time goes on? The priorities here seem a little bit confusing as you're talking about them. Thank you.
Yes. So Morgan, when states are developing plans based on available vaccine, and it's they're not even approved. We think they are. We don't know. I mean, literally our numbers in terms of what our allocation is changes. So we could put out, this whole group is going to get access to a vaccine. And then 2 days later, we'd have to put out, oops, we only got half that allocation. So now it's just this group. So it is a bright spot. I'm happy about the vaccine. It really is a game changer. But it's not so easy to distribute. And there are a lot of tough questions that we have to answer. And we're asking the very same questions you are of the federal government every single day. So yes, as we know what the allocations are, we're going to tell you who's going to be vaccinated. And we're going to follow those CDC guidelines because you have to, although they give you, you're right, we pick the nursing homes, we pick the hospital workers in general, but it has to be in those two categories. Teachers here are the kinds of folks that are considered both essential and high risk after healthcare workers, right? And after nursing homes. So we know that those two are in the mix. Moderna does go to the nursing home residents, but here's who's in the mix. Corrections, inmates, and correction workers, childcare workers, police officers, firefighters, guardsmen and women, utility workers, educators, transportation, public transportation workers, jails. I know I'm going to miss some, but just to give people a sense about, there's very broad categories. If buses aren't running, well, you got a problem. People can't get to work or can't get to a doctor's appointment, can't get to a Medicaid review appointment. I mean, veterans, elders, people with chronic conditions who aren't older folks, children, if you had a vaccine, who have chronic issues or high risk factors, medically fragile kids. Again, there's not a vaccine yet, but just to give you a sense about the different populations, disabled adults living in congregate settings. There's a ton, and every state has those challenges. And if you could say 1 to 10, it depends on how much vaccine we get. So you elevate, you have to deal with the risks in a particular community. So it is going to be, I think, a very challenging first 2 to 3 months. I do expect this. I can't guarantee it, but as the governors are meeting and we have regular weekly, and my testing and my vaccine team in New Mexico, they're on daily calls with the FDA, the CDC, the warp speed folks in the White House and in this administration, and with COVID folks and planning folks in the transition teams. So it's everyone. Everyone is talking about it. I believe you will have, other vaccines. We've heard about Johnson & Johnson. We've heard about AstraZeneca. We know there's been some challenges. Those are getting worked out. There are other vaccine manufacturers that are coming up right behind that have finished, and it looks like very credible in terms of the outcomes, that they meet the requirements for an FDA review. They're coming. The more vaccines that are at that 90+% efficacy, right? I keep hoping that we'll get a vaccine with a 1-dose application. There's lots of stuff happening. That could happen in the next 3 months. That's a game changer. More that are produced, the better we can do, the more populations that we can do at once. So it wouldn't just be police officers. It would be police officers, firefighters, corrections workers, senior citizens, or it'll be all the senior citizens with chronic conditions. Maybe you can follow our pattern here. It all depends on access and availability. We got to do it geographically. We have to do it by population risk, and we have to do it fairly, transparently, and credibly. And we will do that. Dr. Grace, you have something else you wanted to add?
Yeah, just a very brief math comment and just a reminder to everybody that if we get 20,000 doses of a vaccine, that's enough vaccine for 10,000 people because they need 2 doses. Now, it doesn't exactly work that way. We get the first dose, we do 20,000, we get another 20. But at least for the 2 that are coming up soon, you have to divide by 2. And also just, I'm not on that particular team, but the numbers just change more
Every
than
day.
once a day. And it makes it really, really hard to have a plan. I think once we have vaccine actually in the state within our borders, I think we're going to be able to act very quickly.
Right. And one last thing for New Mexicans. I know you must be very frustrated because I am. I'm delighted that we are in this phase for vaccines, but we have to do this work with the current administration. And then it could likely, not dramatically, but shift a bit in the next administration. So it literally is almost hour by hour in which we are trying to navigate vaccine. And it's not New Mexico, it's the entire country. And I can speak for the governors who are all optimistic, but are challenged by distribution and quite frankly, also challenged by the logistics. Safeguarding, getting it to where it needs to go, and making sure it can be distributed effectively. So it'll be tough, but New Mexico's up to the challenge.
Thank you, Governor. Next, we'll go to Chris McKee with KRQE. Chris, go right ahead.
Thank you very much. I just had one question, and it is specific to the area, or excuse me, the zip code that had led the sort of top COVID case numbers for, it's been most of the days over the last month. That's 87121, Southwest Albuquerque, covers neighborhoods like Westgate, Alamosa, sort of west of Coors and Old Coors, and south of I-40. Just wondering if you guys might be able to share any insight as to what you're seeing there. It's obviously, I know the state has partnered with the feds to get more testing over there at the Alamosa Community Center, but any insight as to why that area code has been seeing so many more COVID cases, and if there is anything else aside from that sort of added testing that you guys are looking at doing there? Thank you.
And so you're right, you're spot on the backside, more testing. The more people we can get isolated and support them in that isolation and quarantine, the quicker we can deal with an area that's seeing more COVID transmission than another area. Here are things that we know statewide about risk, including that zip code in Southwest Albuquerque. Multi-generational households, So you've got, and multiple workers, so that you've got multiple folks coming in and out of other high-risk areas. You have a concentration of those aspects in the Southwest zip codes in Albuquerque. We can see mobility, you know, they're driving further to get access to services and goods. That increases risk. We also know that income levels create also risk factors, and those are all things that create challenges that have nothing to do with an individual's lack of self-responsibility or ignoring public health orders. And I want to be clear, I know that there aren't too many New Mexicans who aren't following good public health practices, who choose not to wear masks, and who choose not to socially distance, and who are choosing not to help us get control over this pandemic. There are also far more other New Mexicans who are doing everything in their power to do that and are still challenged by these real issues. But that is certainly, those conditions are exacerbating the ability of Southwest Albuquerque and many other zip codes in the state. And it's one of the issues that causes us such concern in some tribal communities with multi-generational households who have to travel out in multiple places for work and access to good services and healthcare. I'll give you an example. In at least one pueblo, early infection issues happened at a dialysis center, right? So they have to get dialysis. They got it at the dialysis center. Somebody else brought it there, and then they took it into their multi-generational large household, and now you've got an outbreak. And that is an issue that is problematic in a state like ours. And we are, and that, I think these county by county issues will help us deal with some of those problems. Dr. Grace, do you want to add anything about that?
Just a little bit. I think you covered most of it. Just a little bit more of a comment. Months ago, I think I got asked to go, if you could change one thing, what it would be. And I said, eliminate poverty. We followed this data very closely, and this is in census tracts, not zip codes, but low income census tracts since the beginning of the pandemic have had 4 to 10 times more of a prevalence, or your chances of getting coronavirus infection 4 to 10 times higher. And the literature now actually is providing us with a lot of additional information, much more likely if you're low income to be an essential worker. If you're an essential worker, much more likely, almost completely unlikely to be able to work from home, have to go out, more likely to travel across a state boundary to go to work as well, and more likely to have multiple chronic conditions, and the list just goes on and on. And so I'm not sitting looking at average income, just incomes for that particular zip code that you brought up, but I do know that the census tract does have a lower average income, and that poverty is, I think, and maybe I'm just saying this because I'm the Human Services Secretary, but I think it's one of the primary drivers in why we're struggling right now, because we have the third lowest per capita income here in New Mexico in the entire United States.
And it's why the new federal administration that President-elect Biden will address health disparity inequities, because we knew this, but now we see the dramatic negative consequences of having inadequate support and access to basic services by populations who live at or below the poverty line. And I'm delighted to see that that is a significant and serious priority of this new administration. And it'll make huge differences in New Mexico's ability to improve our health status and do better by all of our families statewide.
Thank you, Governor. Next, we'll go to Chris Keller with Albuquerque Business First. Chris, go right ahead.
I wanted to see, are you all, I should back up. Thank you very much for taking my question. I'm curious to see if you all think that the noise related to kind of like a slowdown in terms of a holiday testing around Thanksgiving has kind of worked its way out of the system, and if the numbers you're seeing are a true reflection of the effects of the shutdown. And I guess kind of related, if deaths are kind of a trailing indicator of a spike in cases by anywhere from 2 to 4 weeks, are we still bracing for the effects of the spike in average case rates that we had leading into Thanksgiving?
So I'll do the back part of your question first. And Chris, it's very nice of you to be so polite and thank us. Thank you for participating in these weekly briefings. I've said this often, and I want to say it again. We're not always going to agree. The media and government partners on a headline or, how things are portrayed. That's okay. New Mexico's media has been fact-based, has been working to get, to understand, help us even understand how we communicate these issues poorly, productively, effectively, and help strategize to do this better. And I'm grateful to New Mexico's media and think that you are all a shining example of how we could do public health messaging, public health interest. And thank you for that. While hard questions are hard questions, we expect that you will bring them. So yes, there's going to be a lag and we are bracing. And there's 2 braces, right? We still have the stuff from Thanksgiving, and then we think Christmas is going to be another place where we're going to see the numbers go up, which is why the reset and then really working on a different strategy county to county. And yes, even though you have fewer people testing after the holidays, that's that percentage of that body of tests, that positivity rate, and also looking at those rate of infection factors. That becomes your relevance key to make sure that, and I will be inappropriate a little, when the president of the United, and this is what I mean by picking on the president. I mean, I don't mean to pick on messaging the current president. I think that's always a bit inappropriate, but testing more doesn't make more cases. It just shows you who's positive, and you can do the positivity rates and the gating criteria so that you're providing relevant information all of the time. That made no sense, and it did create, and not from you, Chris, but by so many Americans who really believe that testing is kind of a scam. And that has been hugely problematic. It didn't help when the president also said, it's awful, they scrape your brain. I mean, just all of that doesn't help in getting people. I've been tested many times, and it's with the getting way up there test, and it's not a problem. I certainly don't want to do that, I guess, every day, but it is not an invasive test. And so have confidence. Get tested. So yes, the 2 weeks did not just bring the number of cases down, and those are related to the number of tests we perform, you're correct, but the number of positives out of that case is a relevant, reliable indicator of where we are and where we're headed. So I feel good about the reset. I do not feel good about the economic issues that this has on local businesses, which is why our economic package out of the special session was so critical. Dr. Grace, I don't know if you had anything to add about that.
Yeah, I wanted to echo your comments about the media, Governor, and the accuracy of reporting. I think you really are helping educate the public, something I just feel incapable of doing without you. And you're come every week and you're ask great questions, and we get better as a result of responding to those questions. 2 things. One, Governor's exactly right. If it was just simply people not getting tested, we would have seen somewhat of a drop in cases, not as much as you'd actually think, but a little bit of drop in cases, not as big as we actually saw, but you would see test positivity rates go up, and they went down. Just for your interest, the modeling team has spent a good deal of time on the topic of Thanksgiving over the past couple of weeks, and is this real, is this not? And so we got some really smart people from Los Alamos National Lab and all over the whole state weighing in on this issue. And so we are wrestling with it. But the important thing I did want to say is that in terms of bracing ourselves, our delivery system is absolutely bracing itself for this. Because, if you saw those curves I showed, hospitalization's not going down. They will continue to go up for 2 weeks. And deaths not going down. Those are going to go up for 2 weeks after hospitalizations start to turn down, if they do. And then finally, what the governor said about late effects of holidays, that's why we're watching closely. And and focus. But it's a great question when we've asked ourselves and actually debated. And I think there's a consensus. I mean, there's no question there's a consensus. This is a real change. This is a real positive change. We just hope we can get through it, keep the case count down so our hospitals can get through this for another week or so. If not, then, well, we had another press conference about that a couple of days ago.
Thank you, Governor and Dr. Grace. This will be our last question from Susan Dunlap with New Mexico Political Report. Susan, go right ahead.
Hi, good afternoon. Thank you so much, Governor and Dr. Grace, for this opportunity. I wanted to ask about, with the state going into the standard crisis of care, do you have any concerns that there could be instances of hospitals reaching a point where they're so overwhelmed by COVID patients that people who are going into labor won't receive positive delivery care? And do you have any data showing at what point COVID cases could so overwhelm a hospital that they would reach a point where they couldn't provide delivery care?
Susan, it is something I talked about last week without giving you specifics or a data point, so I'll go to Dr. Grace. But I am very concerned that if we don't drop the number of people needing hospital care because of COVID, and we can't get to a better baseline, yes, it impacts the ability to care for expectant mothers and their families. It is elective surgeries, and that's a misnomer. If it's not life-threatening, sort of you can put it off, but there are lots of procedures that should not be put off. And I worry about that every day, including some cancer treatments that are in hospitals. We are, the crisis standards of care, we are at a point where we worry about being able to meet the needs of COVID patients in general, which means you aren't paying attention to a car accident, a fall from a ladder, an anaphylactic shock episode from a medication. I mean, I could give you more, a stroke, and an expectant mother who's ready to deliver, or someone who goes into premature labor, someone who has appendicitis. I mean, there are a number of conditions that happen every day that require not only in-hospital care and treatment, require surgery. And so, yes, it is dire. It is dire around the country. And why do we care about that? It's not as a way to say, gosh, New Mexico's fine because it's happening everywhere else. No, but we can't fly you for care someplace else because they also have capacity issues. I mean, that's what we do, is we move people around so that you get care. So we're very, 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 very concerned. We are tracking that data. I'm going to go to Dr. Grace about some of the specifics. I just asked this, actually, I asked this last week. Susan, I said, how many expectant moms do we have statewide? And when do we think that their deliveries ought to be occurring? And that's one data set I wanted to look at. I asked for that, the number of strokes we typically get, heart attacks we typically get, and accidents we typically get during the winter. And I don't know, I haven't seen that data yet, so I don't know if we got it yet. But interestingly enough, I asked this very same question last week of the modeling team so that I could grapple with what's coming. Dr. Grace?
Yeah, thanks, Governor. We're working on that still, but we do know there's about 23,000 babies delivered in New Mexico on an annual basis. Most recent complete year of data, 2018. It's about 63 babies a day. I think, there's some things that have happened in the past week that we talked about a little bit the other day, but you've got the Office of the Superintendent of Insurance putting a moratorium on changes to insurance to eliminate coverage for COVID care for providers of all different types. You've got medical boards and other boards deliberating or sending out notices to their the people they certify, saying, we get there's a pandemic, we know you're going to have to do things beyond the scope of your license, and so we're not going to take action against you. Now, the medical board has delivered one of those to allopathic physicians, but I believe others are coming based on conversations I've had. And then the DOH last night extended protections to those providers who are really moving well beyond the scope of what they would normally do. Pediatricians caring for adults, or anesthesiologists leaving the operating room and up in ICUs. And so all of this is intended to allow our providers to get even more creative about expanding care further to prevent what you're bringing up. But, and so, there are patients today being taken care of in New Mexico hospitals and hallways. There are complete outpatient clinics converted to hospital halls, with full of hospital patients in them. There are operating rooms converted to intensive care units, and surgeries closed down. DOH also issued a prohibition on non-medically necessary surgeries in those acute care hospitals as well, to free up additional resources. So a lot going on with the goal of trying to expand as much as we can. But the simplest answer to your questions is, yeah, if we see another surge in cases well above where we're at now, we don't have the capacity to take care of every single person. We just don't.
So Nora, I'm going to end with this, which is why we have to get it right. We're going to serve and protect every New Mexican. We've shown, frankly, several times that we can restrict the ability of the virus to spread. We need to just keep it up. And I know it's hard. And I know that this 6 months from now, when we're saying, Christmas in July, more vaccine penetration, more opportunities, seems like a lifetime away. But if you think about those 6 months, that you'll have a much better normal, right? That normalcy opportunity, and that your sacrifices today save lives, protect healthcare workers, first responders, make sure that our new moms and New Mexicans who, through no fault of their own, have a medical emergency. That's an easy sacrifice. We can all do that. And then mask wearing, staying home, socially distancing, it takes longer to get some of those, basic supplies, because we're limiting folks into grocery stores and big box stores. It's all hard. I never said these sacrifices would come easy, but we can really make a difference for New Mexicans and for New Mexico. And frankly, states are following our lead. California, Oregon, New York, cities like Philadelphia, more coming, because these strategies work. And we believe that if New Mexicans continue to fight against this virus, that this red to green will work, that more counties will get yellow and then get green, that more hospital beds will become available, that will give our healthcare providers a bit of a rest in that regard, and then we'll know that every New Mexican has equal access. We aren't there today, and there are significant risks to all of us if we don't get it right. But I know that we can. So New Mexico, stay safe, stay ever vigilant. We can do this. We've demonstrated it before. Let's demonstrate it again. I believe in you. Thank you, New Mexico. Thank you, everyone, for joining our press conference. Thank you, Dr. Grace.